Psoriasis is a chronic inflammatory skin disease. Approximately a third of the people with psoriasis will develop a chronic inflammatory condition that is called psoriatic arthritis that affects the joints and the spine and can lead to significant joint damage and disability. So my name is Lihi Eder. I'm a rheumatologist and a scientist at Women's College Research Institute. We are trying to improve the diagnosis of psoriatic arthritis in psoriasis patients by developing a new model of care. People with psoriatic arthritis tend to have many other diseases such as metabolic syndrome, obesity, diabetes, as well as high risk of developing cardiovascular diseases. So men and women experience arthritis differently. Although men tend to develop more severe joint damage, women tend to have a worse prognosis because women report more pain, they tend to be more disabled. They also tend to respond less well to medications and have more side effects.
The process I went through to be diagnosed was really long and really tedious. I ended up seeing all sorts of specialists, wondering if I had Lyme disease, if I had MS, because I was having a lot of pain in my arms, my hips, all sorts of things. And finally, my family doctor referred me to Women's College Hospital for rheumatology. And thankfully, I was able to be with Dr. Eder, who knew so much about psoriatic arthritis. And she finally had an answer for me. One thing that I think has made this process a lot easier is that every specialist and every doctor I've seen at Women's College Hospital is completely different than anywhere else I've been. Everyone's been really encouraging, kind, supportive, and actually listening, as opposed to viewing me as someone in a gown. I hope for research, I hope that they'll be able to find a cure. So right now there's only medications to reduce inflammation, to reduce pain, but nothing to really reverse the effects. So I think that would be amazing.
Over the past decade or so, there's been huge advances with the development of biologic medications that target specific proteins that are important in the development of arthritis. So I think there is a good hope that eventually we will find something that, I don't know if cure is the right word, but controlling the medication and achieving remission in a significant proportion of the patients.